My name is Dr. Damboyi. I'm a consultant with the NHS. I just want to demonstrate to you in a short video how to monitor your blood pressure yourself. And this you can do at home, or you do it at work in your office, or if you're someone who travels a lot, you take it along with you and monitor yourself even in your hotel room. Why are we to do this? Because you could do this blood pressure measurement and save your life, save the life of your loved ones or a friend. And who are those that are supposed to check it? Anyone who is 40 years and above, those who are on treatment for blood pressure already, those who are on treatment for high blood pressure, for diabetes, and also for high cholesterol, or those who are having long-standing illnesses and need to monitor their blood pressure. Sometimes even with acute conditions like malaria, you need to check your blood pressure as well and see, because it can change. Now, what are the requirements for this blood pressure measurement? You need just an environment that is relaxing, where there is no disturbance or interference. And in your home, it could be in your bedroom, especially if you have a nice dressing table with a stool, where you can sit on your arm on the table, or in your dining area, or in your study. And in the office also, on your office desk, you can do it. You need a chair, sit down, relax, and make sure that your 2 feet are on the floor. And you also need a good blood pressure machine, and that is why I've chosen this PAAS diagnostic, which is very portable. I've been using it for 2 years now, and I find it very reliable because it takes about 4 AA batteries, which last, well, since I bought it, I've not changed the batteries. And also you can use an AC-DC adapter if you have a 6 volts DC adapter to connect to it. Now, it has ability to give you the upper reading, which is called the systolic. That's at the point where your heart is just contracting. That's the biggest force it's going to apply to push the blood around. And the diastolic, which is where the heart is relaxed and at its best point of relaxation. Then it gives you the pulse, which is equivalent to the heart rate, and tells you how quick your heart is beating. Your systolic should not be more than 139, and the diastolic shouldn't be more than 89 in normal situation. And the pulse rate, usually normal, is between 60 and 100. Anything above 100, your heart is beating too fast, and anything below 60, your heart is beating too slow. But it depends on how active you are in terms of your physical activity and engagement. Now, the other people who need to do this blood pressure are pregnant women. They could be younger than 40, but you need to keep an eye on your blood pressure when you're pregnant. And this machine comes with a cuff, which is the important part of it as well. And this cuff has to be the size for your arm. And for me, I need a cuff of about around 14-15 inches. And this is just the right cuff for me. But if you are skinny and slightly slim, you need a cuff that is smaller. But if you are fatter than I am, you definitely would need a bigger cuff so that you can get your readings right. And you insert the cuff in such a way that it's not too tight and not too loose on your arm. And there is a mark here which I want to show you. This mark is where your artery is supposed to be, and this artery is the one that runs from the edge of the elbow here to the armpit, and it's called the brachial artery. It runs along this arm. So you need to set it in such a way that this stays on the brachial artery so that it gives you the accurate reading. And then you connect it to the machine at the side so that it can pump the air into the cuff nicely. And you put it on your left arm, because this was designed for the left arm, and because the left arm is closer to the left side of the chest where the heart is. You just put your arm on the table and rest it nicely, and you just press the start button, and you just leave the machine to do its best. Be quiet, no disturbance, and smile. Yeah, my blood pressure is absolutely fine, 137/87, and my pulse rate is 77 pulse beat per minute, and the time is 2:46, and today's date is the 8th of May. Please do this regularly and extend it to the rest of your family members and friends, and make sure you keep an eye on your blood pressure, and you can save a life. Thank you very much for watching.